Welcome to How to Scale Your Clinic Operations for a Thriving Business. Running a practice is more than just about providing excellent patient care. I know this firsthand. It's about creating a really well-structured, efficient, and thriving clinical business that supports your team and your growth. So today I'm going to be diving into the 5 essential departments that keep a practice running smoothly. And I'm going to show you how to build an admin and clinical team that grows with you. So whether you're a solo practitioner in Newfoundland or a multi-practitioner clinic on Vancouver Island, we're going to walk you through the exact steps you need to scale your operations accessibly and successfully. And then throughout my presentation, I'll be answering questions along with the topics I'll be presenting. So for those of you who are here live, please hop down to the chat, go to those 2 little bubbles. It will open up a Zoom webinar chat on the right-hand side of your screen. Select the drop down that says everyone, and that way you'll be able to connect with everybody who's joining us live on the webinar today. So feel free as I talk to, first of all, let us know where you're watching from. What city and province or city and state are you joining us from today? And I'd also love to know if what health discipline you're working from, and if you're a solo or a clinic owner, solo practitioner or clinic owner, that's always helpful too to get the conversation started. So just join in at any point today during our webinar. I would love to hear all your questions as we go. And if you've got comments, feel free to go comment as well. We do have our Ginger Desk support team also here on the chat today. So we have Marika from our accounts department, and Taba is here from our marketing and our partnerships department. So if you have any questions about the company itself, they're going to hop in and be able to answer some questions for you directly. So today we're going to keep this tight and impactful. It's 30 minutes of insights so that you can get back to building your thriving practice. And whether you are just starting out or looking to refine your operations, this session will give you some practical tools and some new, fresh ideas to help your practice thrive. So here is our agenda for today. We're going to talk about the problem as I see it. What got you here won't get you there. And I'll explain what I mean by that shortly. We'll also talk about where the heck to start and how to do an admin audit on what's going on currently in your practice so you can find the gaps. We'll then talk about the benefits of building a solid foundation in your operations department. I'll introduce you to the Ginger Way to build your progressive front desk. And then we'll talk about a real world example of a transformation when systems are set up appropriately from the start. And we'll jump into Q&A if needed. Now, if I don't have time to get through all the questions at the end, we'll make sure that we send you an email to answer your questions afterward. But what I'm going to try to do is prioritize folks who have questions as we go. So don't hold back. Make sure you ask your questions as we go. That's why you're here live. That's why you're taking time out of practice. And I'm totally here to help. So first of all, my name is Dr. Julie Durnan. I am the CEO and founder here at Ginger Desk. I'm also a naturopathic physician, and I've been in practice now for 19 years, so almost 20 years. And at Ginger Desk, we are a team of virtual assistants who are specialized experts in health admin, EMRs, and creating systems to run efficient, organized clinics. We have worked with literally hundreds and hundreds of health practitioners all across North America. And aside from running the actual day-to-day of practices' front desks, we also do practice admin audits. We create office manuals that we like to call practice playbooks. And we work really, really well with clinic owners, supplementing their staff behind the scenes. We also work equally as well with solo practitioners. We either support them fully, taking over all the admin for them, or we support what their current clinic isn't quite providing in the background. We live and breathe clinical workflows and efficiency in clinics and solo practices, and this is totally our jam. So thank you so much for joining us today. Now I'll start with a quote. This is by Marshall Goldsmith. So what got you here won't get you there. And this is business advice that I really have learned to live by. And I'm going to explain what this means for you in the context of health practices. So, what worked for you when you were small and just starting out? Maybe you were handling your own admin, or you had a part-timer who worked a few hours a week for you, or maybe they just popped in on occasion. This doesn't scale efficiently. So, when you first started out and a problem popped up, you could easily fix it. With a little bit of hustle, you could just jump in and then repair some of the small gaps that show up. But as you grow, so as you scale, whether it's adding a new practitioner to your practice, maybe you hire on an associate, or maybe it's just that your practice suddenly boomed during a certain quarter of the year. These gaps will become magnified. This I know is true. So, what this looks like in real life is that when a problem arises at scale, you just can't jump in to fix it anymore. It becomes bigger than you are, and it results in damage to either your revenue or worse, your reputation. So, what I see most often in practice owners, the practice owners that don't scale, is that they often don't scale until they're totally busting at the seams. They don't set the foundations up properly in the beginning, and they don't systematize their practice like a business. So that scaling then ends up feeling chaotic, and it feels painful on admin staff, on the practitioners, and worse on the clients. So even if you don't know where you want to go, so you might not know that you want to have another location. You might not think that you want to add practitioners to your business because, look, I didn't. When I first started out in practice, my vision was actually to have a really small, quiet practice in a basement suite so that I could have children and have a really small, quiet life. And look, that just isn't what it ended up being. So you don't know where your ambitions are going to lead you. So my suggestion is that it's critical to build foundations that scale and build them early and correctly from the start. This then gives you so many options for how to go and how to grow later. This will minimize the risk on you, and it will scale beautifully as you grow and will feel so much more comfortable for absolutely everyone in your practice's orbit. So, the scope of our chat today, I'm speaking only to your operations department. So, I'm here for any questions you have about scaling the clinical side of things, but I just want to delineate that we are here to talk about your ops department, your front desk, your admin department first. You might be interested in scaling HR, marketing, systematizing your programs. That is a talk for another day. For now, let's keep things to front desk. So it's often the last thing that people want to talk about. And it's the first thing where things go sideways and throw a wrench into your reputation and your revenue. So let's dive into why creating process in your ops department is so darn critical. And first, we're going to start with the constraints that you need to look for in your practice. And you probably already have a bunch of these that you're seeing. So the top 4 signs of clinical constraints at the front desk that we see here at Ginger Desk are these. Now, if you're new to practice, amazing. Maybe you haven't made any mistakes yet. So you can set things up right from the beginning and you don't quite need to do an audit. The good news is if you're an existing practice owner like I am, then it's not too late. It's never too late to start anything, in my belief, but it's also never too late to get your practice organized. So let's talk about where you can spot the gaps first so that you can first recognize that there actually is a problem. And then that's why we're here today, and I'm here to help. So number 1, a communications breakdown. So you can look for communications breakdowns in your clinic by looking at, are you missing calls? If you are missing phone calls, then you have a communication breakdown somewhere in your clinic. If you have email delays that go beyond same business day, that's a communications breakdown as well. If you have clients that aren't getting recalled regularly, also a communications breakdown. So let's think over to our colleagues in the dental industry. They are exceptional at telling us that we need to come back twice a year. Their recall system is like, it is dialed. It is just so well oiled. It is like military precision. We need to take a page out of their book. And so there's nothing in this allied healthcare industry that we can't, there's no reason why we as allied professionals rather can't copy that from the dental industry. So if you're not doing client recalls already, because the most successful clinics do, that's something that you need to call out as a gap. And the last one is if you've got patients expressing frustrations with delays, this is a big red flag. So one patient complaining about delays is too many, in my opinion. It then tells you that you've probably got 10 other patients that are already frustrated. They just haven't voiced it yet. The next one is document dropping. So this might look like intake forms not being completed before a new patient comes in for their first consult. It can be documents that aren't filed or aren't filed same day. So this might be lab results that come in. Patient might be sending certain results into your front desk. You might have referrals from other practitioners, or you might just have any other kind of documentation, reports, or faxes. And if they're not getting filed, this is a huge problem and it will end up as a complaint from a client at some point. The last one in terms of documents that you want to look for is SOP. So when I say SOP, I mean a standard operating procedures manual. If you don't have one, or if you don't have one up to date, this is a problem because then you're relying on everything being in your front desk's brain. And chances are, if they get hit by a bus, if they're sick tomorrow, if they get pregnant and go on leave, you're left with no instruction on how next to train your next staff member. So that's what I mean by documentation. And I want you to look for the gaps that exist right now today in documentation in your practice. Now, the next one is payment problems. So this can look like consent forms for insurance not being signed. So if you are collecting insurance or doing prior authorizations in your practice, and you don't have patients signing a consent form, that's an issue. If you have accounts receivable piling up, so I love to keep accounts receivable under 48 hours. If you've got it beyond 48 hours or worse, beyond 30 days, 60 days, 90 days, or a year, we've seen it all at Ginger Desk. If you've got that, then you've got payment problems, you've got collections issues, and you don't have a process in place to collect that revenue that is due to you. You might have practitioners sending their own payments. In my opinion, this is a gap and this is worth looking into because this is where a lot of issues end up piling up as clinics scale. If you have a group practice with 10 practitioners who are all sending out invoices on their own, chances are the reconciliation is very difficult to do and it's probably not being done. So the other thing is reconciliation. Is it being done day to day? And is it being accurate week to week? So that's something to really look at. I have met so many clinic owners who are like, reconciliation, what do you mean? Doesn't my EMR just do that for me? And the answer is no, it does not. You need to make sure that if you've got like e-transfers or you've got an in-person POS machine or you've got an integration for payments, you need to line all of those things up and make sure that the payments that were sent out were actually collected to the dollar. Now, people. So I always talk to our clients and also our team here at Ginger Desk about process versus people. And I really believe that the right processes are necessary first before you bring in the awesome people, because even the most incredible person will not thrive if the processes in place are just terrible. So if your practitioners are struggling to keep up with their admin, this is a sign for you that you've got a problem at the front desk. If you've got front desk staff that tells you they're burnt out or they're showing signs of burnout, like they're disengaged or they're showing up super tired at work, they're missing days of work. If you see any of those signs of burnout, like lack of motivation, you know that there is a problem with your processes at the front desk. Similarly, if you've got turnover at the front desk, that's a big sign that the processes aren't correct. So you might have hired the wrong people. That's totally possible as well, but it's often that the processes just aren't set up for people to thrive. You might also have low morale. So you might have gossip going on, a poor culture. You might have the folks at the front desk complaining about their jobs or telling people they just don't understand what to do day to day or it's too much work. That's low morale. That's a poor culture. And that can all be solved with getting better processes in place. And then if you've got patient retention issues, certainly, you do need to look at the quality of your clinicians, absolutely, but you also need to look at the quality of your recalls and the processes in place at the front desk. So are you booking people right after their consult? Are you reminding them when they've missed a visit? Are you rescheduling them as soon as they've canceled? There are so many processes that are really simple to make sure that your practitioner schedules are filled consistently. So the result of all of this, if there are gaps in your practice, is that it will impact the patients. It will impact your clients. So over time, they'll get really frustrated that their time is wasted. They might even perceive that there's poor care given at your clinic. So if their documents are getting lost, or if they're not hearing back from your front desk staff for like, 2 to 3 days or a week, they're going to perceive that that is impacting their healthcare. They might then decide to look toward another clinician in your clinic, or they might look elsewhere outside the clinic. And ultimately, this will impact your revenue and worse, your reputation in the community. So let's talk about where to start. So I like to call this a practice audit. And you can do this right now while we're here today and just have a think through these departments while I'm talking and look for areas where you could actually improve. So let's talk about the 5 critical departments that you already have at your clinic's front desk. So even if you're a solo practitioner, you still need to look at dividing your admin up into these 5 areas. So number 1, we've got booking and communication. So this is up at the top here. We've got your department that does all the bookings and all the communications. Then we have a section where we handle document management. We then handle payments. We then handle phones. Now, phones are different than booking and communications because booking might be something that happens sort of behind the scenes. Communications can be asynchronous if we're sending emails, but phone definitely needs to happen as the phone call comes in. So it happens in real time. And then we've got what I like to call discipline-specific client care. So I can see that we've got some nurse practitioners here, psychotherapists, physical therapists. Now, if you're a therapist, you might need a little bit of added love and care when you do intakes for new patients. So you might want your VA or your front desk staff to do some added screening for them. Similarly, if you're a nurse practitioner or you're a naturopathic doctor, you might need extra support from labs. So there might be a full lab workflow that you want your front desk to take care of. I'd like you to think about those things as actually just a separate department altogether, because they are going to be a specific skill set that is different than the skill set you want in payments and in communications. So have a think around that. For physical therapist, it might be exercise prescriptions, like somebody who's specifically handling those. That might be the case. It might be product sales as well. Now, to ensure optimal productivity, to de-risk your practice during times of change, and to ensure adequate coverage during absences and goodness, worst case departure of a front desk staff, we actually at Ginger Desk suggest different people support these different responsibilities. And like I just said, for the specific skill set required, it's that every department actually requires a different skill set and a different timing. So let's dive into each department. So first of all, booking and communications. In this department, you want someone who is charismatic, very well organized, and highly responsive to patient needs. This person probably needs to be very compassionate if you're working in a therapy practice. Now, if you're in physio, you probably need them to be really timely and making sure that they're sending the exact information in a really timely manner, because they're probably coming in with pain possibly. So this is responding to emails and then going into EMR portals and doing EMR portal messaging and also text messaging. So you want these people to be excellent patient communicators, awesome writers, and highly compassionate. Now, document management. So the people who handle your documents need to be super organized. These are your type A personality people who like Marie Kondo their entire life. So they are going to be the ones making sure that every document is downloaded from the fax, from the portal, from the email, and that it's filed appropriately in the patient's chart. So they're going to make sure that your filing system is color coded and gorgeous. They might take control of your Google Drive. and make sure that every department has a beautiful folder that is, again, color coded. They might tag your practitioners appropriately as needed. And then you want them to be the ones that handle your fax. Now, moving on to payments. So these are a different type of people. These people are also really smart and also really organized, but they don't necessarily need to be the front face of your practice dealing directly with the patients. You want these people to be excellent at math and awesome number crunchers. So they're the ones that are dealing with your invoicing, dealing with your US insurance pre-authorizations. Here in Canada, you want them doing your direct billing. And as we know, these are really advanced skill sets to understand the different portals, to understand the different autism funding versus Pacific Blue Cross. There are so many different companies that we need to deal with, and they really need to be in the know about those. And they can be behind the scenes on their computer doing this in an asynchronous way. They don't necessarily need to be doing this while being interrupted by patients walking through your front door. You want these people doing your accounts reconciliation because they're going to be the ones to make sure that every number lines up. And then they're the ones doing reconciliations at the end of each week and making sure that accounts receivable adds up. Now, live phone answering. So these are the people who are at the ready. They are not busy doing other things because they're capturing every single call that comes through with absolute compassion, charisma, and responsiveness. So again, this is again a different skill set, but these people are doing live phone answering, they are checking voicemail if required, and they're making outgoing phone calls uninterrupted in a quiet environment. And then as for discipline specific care, so again, if you're a medical doctor, functional medicine doctor, nurse practitioner, like we have here, um, you might have a full lab workflow that you need done. So here at Ginger Desk, what this looks like is RVAs will write lab recs for you. They will then collect payment from the patient for the lab. They will then make the lab rec visible, or they'll send the patient the lab rec. They'll also track the outstanding lab recs that are out there. So in 6 weeks' time, or whenever you deem that appropriate, we'll check in. Why haven't you got your labs done? We'll be checking the portals every day to make sure that we're checking for results. We'll file them in the patient's chart when they're ready, and then we'll ping the patient when the results are in. So that probably sounds like a whole lot to anyone who doesn't work with labs on a day-to-day. But those of us who do, we know that it's actually a huge chunk of time. It takes up a lot of our day when we try to do the lab workflow ourselves. So I see a lot of new grads coming in the medical industry who are happy to do the labs on their own when they first get started. And I think that's totally appropriate for them. But what you need to do is make sure that you set up and document the SOP for how you want that workflow to go, because very, very soon you're going to realize that having an admin staff do that workflow generates way more revenue for you. So then you're freed up to see a lot more patients, because lab workflow can sometimes take up half your patient hours. We've seen that happen a lot. And then again, for those therapists who are on the line right now, there might be some more standard intakes that you want us to do. So there might be some more comprehensive rather intakes that you want us to screen your patients and make sure that they're matched to the appropriate therapist. So that's another discipline specific support that you might have as a different department. Now, one-time projects. So don't hire full-time for this. This is a mistake that I see over and over in our industry. People think, okay, I'm going to switch EMRs, or I'm going to go from paper charting to EMRs. That's another big one. And I need an office manual set up, and I think I'm going to hire an associate. I need to go hire a full-timer who can just take that on for me, but not necessarily. So don't jump the gun and hire a full-time $60,000 a year person for this one-time project. This is probably something that you can get done in 1 to 2 months, and then it's done. And then from there, you can have your day-to-day admin who might just work part-time for you or fractionally for you. You can have them update the documents or update the software that person did. So hire for a one-time project if you're doing an EMR setup. If you want to implement a practice playbook or an office manual, again, hire for the one-time project, make it an 8-week project, and then get them out of there. You don't need to hire full-time for this. You heard it from me. Now let's jump into the benefits of looking at your operations in 5 separate areas. So you end up getting highly specialized teams doing the right thing. So what I mean by this is you get the right people in the right seat with the right processes every time. And this results in better care for your patients. You also de-risk your practice. So by having different folks do different things, if one of them leaves the practice for any reason, your whole front desk does not fall apart. So it really de-risks your whole operation when you have different people devoted to different areas. And again, they're not different people working all full time for you. This can all add up to still costing less than a full-time front desk staff, but it de-risks your practice ultimately altogether. You also have a lot of improved coverages during absences. So if you've got one person off, when you have a Teams approach, especially a virtual team like Ginger Desk, we have a full coverage system behind the scenes. So when one of our VAs is away, we have another VA step in and use the same processes that that other VA did so that there's no downtime for your practice and your practice doesn't miss a beat. And then it really becomes easy to scale with unexpected growth. So if you end up in the fall realizing, because the fall tends to be such a busy time for us, in the fall, if you really see a ramp up in September of your patients, all of a sudden you're like, shoot, I am doing way too much here, or my admin staff is way too busy. This is the time that you're able to just pull a lever and you've, boom, got more support when you've already got a virtual team in place. Similarly, if you add another practitioner, you really meet someone who you adore and seems so aligned to your practice, you can easily onboard them because again, you're just pulling an admin lever and getting more support for your front desk. And then you always end up with streamlined communication support tailored to your practice. I left this as the last point because I think it's so critical for folks to understand that the team's approach is actually a better approach because you get the right people who are excellent communicators communicating on behalf of your team. You don't get the amazing payments people that are number crunchers also doing your communication to your patients. So we really get a better concierge, high touch approach for your patients. So I like to call this the Ginger Way, and I want to introduce you to what I call the Ginger Way. And this is about leveraging a virtual team to support your practice. So here at Ginger Desk, we work in a teams approach. So the first person that we always match you to when you join Ginger Desk is a dedicated VA. So whether you are bringing us on for payment support or for maybe you're bringing us on for lab support, you will always be matched with a dedicated VA as your main point of contact here at Ginger Desk. So this person is here to ensure that communications are always easy between you and your practitioners, to be straightforward and scalable. And so no matter the need, the dedicated VA is able to then delegate your needs to the other team members as needed. So this person is an expert in patient communication. They handle all your bookings, your emails, your EMR management. They're HIPAA and PIPEDA compliant, and they'll always maintain inbox zero. These people are also your document handlers. So they are exceptional at keeping the practice highly organized. We also will have this person join you on your weekly alignment call. So you're going to directly be in contact with this person on the regular. You can bring your practice along to that meeting as well if you'd like. And this is the one meeting a week that we really have seen be impactful to make sure that our VAs are aligned with your practice growth and your goals. And so you will always be meeting this person and making sure that they understand the goals for your practice. Now, your payments VA. So this person is specialized in insurance prior authorizations, Canadian direct insurance billing, and processing accounts receivable. So they are the ones that you want in the background, handling all your accounts receivable and doing your reconciliations. And they are a completely different person and team than your dedicated VA. We also have Ginger Phone virtual receptionists. So we launched our Ginger Phone reception service just last year. I'm so excited about this department because it's evolved and it's really scaled according to practitioner feedback. So what we heard from you is that you wanted more discipline specific focused people answering your phone. So we have just that now. So you'll be matched with a pair of VRs. So that's two virtual receptionists who will be there at the ready to answer your phone. And they're specifically matched to you based on your discipline. So if you're a therapist, you'll have two therapist focused VRs. If you're physio or chiro, those are different VRs that will be matched to you. And we're so excited to offer this specialized approach. And then you'll always know who's answering your phone as well, because you'll get to know this pair, and you'll know that they're there to answer every single call. And that's why they work in pairs and not just in singles. And then we have a labs department now because we have so many medical nurse practitioners, naturopathic doctors, functional doctors who use Ginger Desk that we actually will add a lab VA to your team if needed. So these are folks that are highly skilled and trained in managing lab portals, writing lab recs, downloading lab results. They're ordering kits for you. They're explaining collections and samples to your patients. And like I said, they're sending off requisitions as needed. So this is actually a completely separate team that we have working in the background to support your dedicated VA. And then Ginger Systems. So Ginger Systems is the department that we're going to send you to if you need that one-time project done. So instead of hiring a full-time person, you heard from me before, you can just pay someone for 1 to 2 months of work to actually do a really big lift for you. So if you want to do an EMR transition or fully set up a new EMR from paper charts, maybe you want to just optimize how you're using your Jane or your Practice Better account. So if you're not utilizing all the features that they have available, and newsflash, 90% of us aren't, meet with one of our experts and they'll walk you through all the other features that you should be using based on your client's journey. We'll also do other one-time projects. So if you have a ton of backlog of AR, of accounts receivable, we're open to that. We'll come in and do that as a one-time project. We will do other software setups, like getting you set up on Google Workspace for email and for your Drive. We will completely set that up for you. So let us know if you have a one-time project. We are totally here for that. And then if you're here for any other day-to-day support, that's the rest of our teams that will help you. So I like to call us the progressive front desk because we are scalable. We leverage technology in the best way possible so that we're not only efficient, but we're highly productive. And we promote workflows over personalities. So we hire the best people. I can honestly say that. And if my team is on here right now, they can attest to that. We hire exceptional virtual assistants. We have a rigorous process for hiring and training. They go through a 160-hour training program with us after being approved upon hiring. They need at least 3 to 5 years experience in clinic to be considered to work with us. So we hire exceptional people. But I will say this, it's our processes that really set us apart, because you can take the best possible person and put them in terrible processes and ultimately they just won't thrive. So we love to talk about workflows over personalities here at Ginger Desk. And we'll also lower your overhead. So on average, the average Ginger Desk client saves on average 60% what they would have spent on conventional office staff in-house. So I'm here for any questions. If any of you have any questions, I'm going to pause there. And then I'm going to jump into a real life case study and clinic transformation that we have witnessed here at Ginger Desk. So please feel free to hop into the chat if you have questions. So meet Miranda. Miranda is a mental health practitioner. She's a licensed clinical counselor, professional counselor. And before she came to Ginger Desk, she had 10 therapists. I just need to move over my photo here, my image, so I can read this. She had 10 therapists and a really busy group practice. So Miranda, on the surface, was totally thriving. They had 200 clients a week coming through, but the problem was they had this ridiculously high admin turnover. And when I mean high, they literally went through three admin assistants at their front desk in the last 3 months. So Miranda and her one remaining staff member were basically on the verge of tears when they came to us because they were so busy trying to keep up with the work themselves while also trying to hire and train people. Their accounts receivable, because of this turnover issue, was well over $200,000. And this isn't unheard of. If you have a busy group practice or even just a thriving clinic, you know that 200K, it doesn't take long for it to amount to that if you're not collecting things on time. So she had a lot of accounts receivable that was more than 6 months overdue. So it really was long overdue. The admin staff was overwhelmed by client calls, by the AR, and the worst thing is that her patients started complaining. And so that's when she started reaching out to us. I'm going to pause and then I'm going to tell you what we did at Ginger Desk. So we've got a question here. How do you ensure intake forms are filled at Ginger Desk other than by the email reminder prompts? Great question, Marie Michelle. So we literally will look into the next day's consults and see if the new patients have sent them in yet. And if you have a practice policy that you want the the intake forms in 24 hours prior, we will make sure they're there. We have a lot of clients that we work for who want the intake forms actually there 48 hours before a consult. We even work with some specialized niche practitioners where they want it in 7 days prior because they do a lot of research before the client arrives. So depending on your clinic policy, we will adhere to that. We will go in and make sure the intake form is there. If it's not there, we will certainly send them a reminder through your EMR or by phone or email, whatever your preference. So it really does depend. And when I talk about building out an SOP or an office manual, it's this kind of detail that we look for. It's like, what are your preferences and how can we best serve you and what makes the most sense for your practitioners? So let me know if that answered your question. And now I'm going to tell you what we did with Miranda. So the solution was we matched Miranda with a dedicated VA to support her whole team. We also matched her with a payments VA and with a pair of Ginger phone receptionists. So our dedicated VA began by handling the inbox and dealing with all the new patient intakes. So they made sure that every new patient that emailed got a response quickly. Their response time was so terrible. It was well over 48 hours before. We had our dedicated VA go in there and be able to send responses within 4 hours. We made sure that the inbox was then down to 0. We also matched them to a payments VA. So this person was devoted to getting completely caught up in their admin. So they had $200,000 of money to go get caught up on. So this is going to take us quite some time. So we set them up with a system so that this wouldn't happen again. And then we got to work actually collecting the money and doing insurance prior authorizations for any folks coming through onward. We also set them up, like I said, with a pair of virtual receptionists who were then at the ready capturing every new intake, every new initial client that called. They answered every single call in the practice. So what this allowed Miranda to do was to totally realign the way her in-person staff was operating. So Miranda went to this person, and this is what we often suggest at Ginger Desk. Go to your in-person staff. If you have another VA, go to your VA, whoever that person is handling admin for you. Ask them, where do you thrive? What do you love doing? And what do you absolutely not love doing? That's the very first question to ask. So Miranda's staff number 1 told us that she absolutely loves talking to patients day to day in real life at the front desk. So Miranda loved this idea of just having her devoted to creating that concierge experience in the front desk. And then this freed her up so that she could talk to them about their day. She could get a tea for them. She could go fetch them a blanket if they were cold. And it didn't have her hiding behind her computer. It really allowed her to come up above the computer and be this front face of the clinic that she wanted to be. It then allowed us to focus on everything else digitally behind the scenes. So the result was that the clients were delighted because we were able to book them in and get their responses within 4 hours. The revenue came up substantially in the first month by 20%. So we were capturing all of that delayed accounts receivable, but we were also able to capture all those initial patients that otherwise wouldn't have been booked. Their profitability then increased by 20%. And so for those of you who know your numbers, as clinic owners, this is massive. If you can increase your bottom line by 20%, that is monstrous. And we did that right away just by adding these processes and this added efficiency in her clinic. We then went down to 4 hour response time instead of the 2 days they were taking before. And we got their accounts receivable actually down to 24 hours. So that means that when somebody came in for a consult and they were sent an invoice, we had that money collected within a day rather than 180 days, which is what it was before. So Miranda now has a happy team and happy clients. And I'm so excited to announce that she is opening her second location in group practice because Miranda now has levers that she can pull. She can just engage Ginger Desk to now support her next practice. Her practice is running so smoothly with all the processes already in place. Ginger Desk will then support her next location and hopefully her next location beyond that. So my take-home messages for today, please look at the gaps in each of these departments and do an audit on your own practice. This shouldn't take too much time. If you don't know where the gaps are, please go sit down with whoever's doing your admin and ask them specifically about those different 5 sections. Then look at dividing your admin department into those 5 departments we talked about, all before you scale. But once you do that, you are totally ready to scale. Now, does anyone have any questions? Because I'm here for all the Q&A. If any of you want to ask anything else, let me go see if we've got any questions here. Awesome. Great. Thank you all so much for taking the time to join me today. I know how busy we all are in practice, and I so appreciate you being here. For those of you watching the recording, thanks for taking the time out to watch the recording. We are available here at Ginger Desk at hello@gingerdesk.com. You can also find us on our website at gingerdesk.com, and you can book a discovery call there. It was such a pleasure to see you. I wish you all a beautiful day and take care. Thank you.